guys can write it. Okay, so the first thing is assessing the abdomen. Again, we're going to inspect. Okay, so when you're inspecting the abdomen, okay, I'm gonna pull your shirt up. Okay, when you're assessing the abdomen, again, you're gonna expose the person right to there. Again, and you're gonna expose them to here. Okay, so when you're assessing the abdomen, okay, you're gonna look at her contour. Okay, so what's her contour?
Normal.
What are the words that you're saying? Normal.
No.
So it's either the ones you're going to say again, you're going to look at what? The contour is going to be, is it what? You're looking at protuberant,
So
right?
no.
Round, flat, scaphoid, right? Okay, so her contour is what? Flat, okay? So her contour is flat. What else are you looking at? Symmetrical. Symmetrical. Is it symmetrical? Again, so you're looking for symmetry, again. And symmetry would be what? You're making sure there's no what? Like she doesn't have like a bulge sticking out from one side. Again, no. So her abdomen is symmetrical. She has a flat contour. Abdomen is symmetrical, right? And skin characteristics. Her skin, again, is warm and dry. There's no lesions, no rashes, no redness, anything like that around her abdomen. Again, no vascularity is noted. Again, if you see any vessels, no bruising. Again, remember I talked to you guys in class about the bruises, right? What's if she had, sorry, that's her that was a reflex. Which you have abdominal reflexes. You'll see them in your book. You don't really go over them or talk about them, but that's a reflex. So you reflex here and you see her do that. Those are reflexes that you can pull out. But anyways, when you look at her, again, if she had a bruise around her belly button, what would that be? What can that be a sign of? What's it called? You guys remember? The bruise around the belly button?
Pancreatitis, I think.
Pancreatitis, again. Yeah. It's Cullen sign, again. Yeah. There's also Gray Turner sign. Where's Gray Turner sign?
On the flanks.
It's on the flanks, bruising on the flanks. Okay? All right, so that's what you're looking at, and that's where you're looking at the skin characteristics. Okay? Next. It's talking about the umbilicus. Her umbilicus is midline, right? Her umbilicus is clean, okay? It's free of any inflammation, okay? So that's what you're looking at. Is it clean and it's free of any inflammation, okay? Next, what are you going to look at now? Pulsations, okay? So if I'm going to look at pulsations, looking at pulsations, okay, I'm going to make sure, again, if there are any visual pulsations are visible. Again, for her, again, she's thin. So if you look over on your side, you can see she has a pulsation right here. And I can see it. And if I put my hand here, I can feel it too, okay? So, and her pulsations, again, it's right where her, again, you're looking right here. Her aorta is right here, okay? So this is, again, and then you're looking at the vascular sounds. This would be her aorta, right? This would be her renal, and right here, iliac, and then her femoral. Okay. So then next, I'm take my stethoscope, or Miguel's stethoscope. Okay. And I'm going to. So I assessed all that, right? I looked at the pulsation. I can see the pulsation. So I see pulsation, midline pulsation above the umbilicus. I note pulsation there. Okay.
So
next, I can see hers. Most of you probably are not going to see it, because especially if you have muscular adipose tissue or muscle over that area, then you probably won't see it again. But she's this thick. So, huh? No, just visible. Pulsations visible. Above the umbilicus, about 2 centimeters above the umbilicus, there's pulsations present. Okay. But again, I can't really see it like this. I have to go like this to the side for me to kind of see it, and you can see it. You can all, after I'm done, if she wants to let you see.
I could see from here.
Okay, so next is what? After I do that, inspect, then in abdomen we do auscultation. Okay, so I'm going to auscultate again, assess for vascular sounds again over the aorta. Again, what's the best thing for me to use?
The bow.
Okay. So I'm going to listen. Okay, and what am I checking for? I'm checking that there's no bruise, right? Okay, so I don't hear anything there, again, which is good. Okay, I shouldn't be hearing anything. Okay, and your abdominal assessment is only asking you to check over the vascular sound over the aorta. Okay, you do know that there are vascular sounds. Again, we talked about venous hum. We talked about bruise again, which would be your aorta, right? Your renal, iliac, and then femoral. Okay, but for your competency, it's only asking for aorta. Okay, but just for your exams, you know that it's there. All right. So again, nothing, no bruise are auscultated when auscultating over the aorta are heard. And then next it's going to say you're going to listen to your bowel sounds, right? Well, it came after the other one, doesn't matter. Bowel sounds, okay? So with the bowel sounds, I'm going to listen with
the diaphragm.
The diaphragm, okay? And how you're going to listen in all 4 quadrants. Okay. There's, again, her bowel sounds are normal active, again, times 4. Okay, normal active in all 4 quadrants, again. And why did I move so? I was able to move fast because I could hear the vowel sounds right away as soon as I moved out. Okay, can you say that if I don't hear a vowel sound after the first minute, can I say that she has no vowel sounds? No, you need to at least sit in that area for 5 minutes to then be able to say that person has no vowel sounds whatsoever. Okay, so you're gonna hear what do vowel sounds sound like when you guys are listening to each other. Vowel sound. You guys gotta be quiet. So it's easier if you guys just split into your groups. Shh, quiet because their sound they're very low. It's just like that. Or listen to your own when you're home or whatever. It's very like little. Like very low little gurgling type of sounds, okay? Unless you're, starving or something, or you just ate it and it's loud, but, so again, so that's it. I'm asking all 4 sounds. Next, it's gonna be percuss, okay? So what should my sound of percussion be? Timpani, okay? So again, so when I percuss, again, you're gonna use, again, direct, indirect, or what? Indirect, right? So I'm gonna percuss, use, you can hear, so you gotta press a little bit. And you're going to use that figure 8 pattern. So you hear that? And then in this lower quadrant. Okay, so that's the sound of timpani, right? Kind of a hollow sound. Again, it should be that way. If I would percuss down here and I would feel, and it would be more of a dull sound, then that means what? That there's probably stool at the end, in her colon, right? Which that would be a normal sound, okay? But she's tympanic all around, okay? So again, you're gonna explain timpani and dullness. So timpani is what you should hear in the abdomen. If you hear dullness, like especially like in the left lower quadrant, it could be stool. Or if you're percussing in an area where there should be timpani, you have to be worried about maybe there's a mass in that area of some sort. Or you could be just percussing over the organ, right? So, right, her liver is over here, right? So if I can percuss over here again, if I'm over that area, and it's hollow though, again, that means her liver is usually located right under the rib cage, right? So it's good. Her liver's not enlarged. Okay. All right. So that's it for percussion. Okay, and then after percussion, you're going to again. It says palpate. It says locate the liver and the spleen. Okay, know the locations. You just need to verbalize your liver's located on your right side and your spleen's located on your left side. Right? Mm-hmm. That's it. All right. And then the last thing is palpate. Okay, light over all quadrants. Okay. I want you guys to palpate again. You start in this area here. You always make sure you don't have any pain anywhere. Again, because that's the last place I want to palpate, again. And then you're just going to palpate, okay? And you're checking for any lumps, any bumps, any masses, any tenderness, again, when you're palpating over the abdomen, okay? And that's it for abdomen, okay?